Tributes to Robin Williams continue to pour in from all over the world. The Marin County Sheriff's Office has confirmed the actor and comedian killed himself Monday, hanging himself after apparently trying to slash one of his wrists. Yesterday, we reached out to comedian Jimmy Tingle for his reaction to Williams' death. This is what he sent us.
If there's one thing that comes out of this whole tragic situation with actor, comedian, and philanthropist Robin Williams, it is the level of awareness that's being raised in this country around substance abuse issues, mental health issues, and the issues of depression. Fortunately, under the new changes in the healthcare law, it has never been easier to get professional help for substance abuse, mental health issues, or depression. Call your local hospital, call your local substance abuse facility, get help. It would be the only thing that would bring a silver lining to this dark cloud of despair and mourning everybody in this country and around the world are feeling. People loved Robin, they loved his work, they loved his life, and he made us laugh and he made us think. And rest in peace, Robin Williams. God bless you and your loved ones and your family.
Jimmy's poignant plea and the coverage of Williams' death has raised new questions about the shame and stigma surrounding depression and the need to have a more honest discussion about the suicide. Here to discuss that further is Dr. Douglas Jacobs. He's a Harvard Medical School psychiatrist and the founder of the organization Screening for Mental Health. Welcome to you, Dr. Jacobs.
Thank you, Emily.
Seems like we do these things in cycles. Every time there is a prominent person like Philip Seymour Hoffman, it was a combination of substance abuse and depression or whatever he had, and now this. We have these discussions, gets a lot of media attention, and then it just disappears. How do you keep the awareness going?
Well, I think it's really important. Your question is key. How does society, the public, health professionals acknowledge that suicide happens? We know that it happens to about 35,000 people each year. There is a relationship between suicide and mental illness. The common denominator in suicide is intolerable psychological pain. It's also loss of connection with others. If people know either themselves or they know others who experience depression, because depression is the major contributor to suicide, they need to reach out, as you heard from Jimmy Tingle, and acknowledge that suicide can happen, and it's not a weakness. It's not nothing to be. It's not. We have to get away from the stigma. We have to get away from the shame.
All right, but Robin Williams did everything. He was in rehab more than once. He had been recently in rehab. He acknowledged his depression. He talked about it openly. Clearly, his family knew. I mean, if somebody's going to want to take their own lives. In the case of Philip Seymour Hoffman, it might have been accidental. We don't really know, but they're going to do it. You're going to be alone at some point. You're all these things. You can't have somebody. I guess I'm going to say if you want to do it, all these discussions really isn't going to stop anybody.
Well, I beg to differ, Emily, because
I hope so.
as a clinician, as a psychiatrist who's devoted his life to working with suicidal people, working with health professionals and the public, that people are ambivalent. There's a side that wants to die and the side that wants to live, and so that 70% of people who commit suicide communicate their intention to a significant other. We have to respond to that as if they're having chest pain, as if they're having shortness of breath. Get that person to a hospital. Don't try to decide, well, do they really mean it? Are they serious or not? That's not up to a loved one's decision. That when you say when they're left alone, well, one of the things I would say is do whatever you can not to leave that person alone.
Interesting about Robin Williams, I was just reading some of the statistics that I'm sure you're very familiar with. He is the classic case. I didn't realize that. Men in their mid-60s, white, extremely successful, or have had maybe a recent failure or towards the end of their careers, but yet they've had so much success in their life, and then they are vulnerable they're vulnerable to all kinds of addictions, which Robin was, but he was the classic case.
Well, and yes, we refer to those as risk factors of being male, of having a prior history, of having depression, having substance abuse, having stressors. But at the end of the day, what it turns out to be is intolerable psychological pain. And we can help reduce that through communication, through our treatments. Can we prevent all suicides? The answer is no. But can we intervene in the majority of them? The answer is yes. And that's what all this awareness is about, to try to get people to understand that there is something that one can do about suicide. A teacher of mine once said to me that suicide prevention is everybody's business, and for people to try to take it on. If they see someone talking about suicide, talking about wanting to die, being a burden to others, being in intolerable psychological pain, reach out, get that person evaluated, treated. You can save a life.
All right, Dr. Douglas Jacobs, thanks.